Tonight, the FDA is considering authorizing emergency use of a drug doctors say has proven thus far to cut down on recovery time for COVID-19 patients. And St. Louis plays a role in this. News 4's Kim Zainaj is talking to the lead researcher. She's live for us tonight at St. Louis University Hospital.
Sam, we know 14 people agreed to take part in this study right here at SLU Hospital. They were either given the drug itself or a placebo. Neither of them knew. The doctor nor the patient knew which one they were getting. Doctors tonight telling us 12 of those people have been discharged from the hospital. Renewed hope tonight for COVID-19 patients as we hit more than 1,036,000 cases in the U.S.
Remdesivir has a clear-cut, significant positive effect in diminishing the time to recover.
The antiviral drug remdesivir, developed in 2015 to treat Ebola, now believed to block COVID-19.
This drug works. We're going to try and make it as widely available as we can as soon as we can.
Dr. Sarah George is the lead researcher of the study at SLU Hospital. The 14 patients who agreed to participate were given the drug or a placebo through an IV.
The medication was infused once a day for 10 days. They got either medication or placebo. We didn't know what they got. They didn't know what they got.
SLU Hospital is one of 68 sites worldwide to test the drug.
People who got the medication had about 11 days on average time to recovery. People who didn't get it had about 15 days on average.
It also dropped the death rate by almost 4%.
This is the first medication that has been shown to be beneficial in people with COVID disease.
A smaller Chinese study published today confirms faster recovery in patients who receive remdesivir early. Dr. George hopes the FDA will fast-track the drug's approval process so doctors can offer it to as many patients as possible.
Myself and my colleagues are seeing a lot of people die, a lot of people where we're having to have hard conversations with their family about telling them that their loved one is just not doing well and probably isn't going to make it. So this is actually the first, if you will, ray of hope we've had in this whole outbreak in quite some time.
SLU study has wrapped, meaning this drug is not available to patients unless the government approves its usage. And Sam, I want to mention this. I did ask Dr. George about possible side effects from taking part with this drug. She said they're minimal. That was the word she used to describe them. That includes possibly changing the chemistry of your liver, she says, and slightly altering your blood, just basically thinning it out so it would make it a little bit more difficult for it to clot. She says once you're off of the drug, things should go back to normal.